I'm Dr. Brian Ailes. I've got a buddy in today. His name is Dustin, and he's a blue belt in jiu-jitsu. He's got an ear issue, and we're gonna check out what's going on, and I think I hear him now. Hey, buddy, how are you? You're good. Come on back, let's check that out. Okay, so we've got Dustin here with an active cauliflower, and I'm asking him a couple questions and figure out what's going on, how long it's been, and we'll move from there into the process of taking care of this. So I want to know how long it's been since you've had this and what happened.
About 4 to 5 days.
Okay.
It's just been getting worse and worse. Every time I train, it keeps throbbing.
Okay.
It's really soft right now.
Okay.
It's just getting bigger and bigger.
So the challenge is when we look at this, a lot of times there's obviously going to be draining the first part. You want to get the fluid out of the ear, and then we'll move on to what we're doing for compression. And when we look at the compression, we're going to pick the right size disc. We're going to I'm going to instruct him on how to position them, how to clean them, how often to take them off, put them back on, and run through the process of the number of days it may take and what he can expect. So one of the things is a lot of times, depending on how long it's been an issue, a lot of times they're using syringes. A lot of docs will use syringes that are very, very wide in diameter. This is a very wide millimeter. It's not necessary. If this is 4 days, we don't need that. We can actually get away with 4 days. We can get away with a little diabetic syringe, which is a very, very small needle, not painful at all. It should move the fluid out. If there's a high volume like we have, we may use 2 or 3 of these, but it shouldn't be a huge deal. So it's not going to be a big deal for you. We'll use it until we're done. And if it's a massive hematoma on the ear, then we use something with a similar gauge, which is longer, but you have more volume to pull the fluid in. So we're going to start with that and take care of the ear, and we'll go from there. Okay, so what we're going to do now is we're going to just sort of prep the ear for draining. And what we're going to do is we're going to clean both sides. We're going to clean where we're going to drain, but you want to clean everything. You want to clean the fingers, you want to have gloves on like I do, you want to get the back, you want to get the front, and you want to figure out exactly where you're going to sort of make your site for aspirating this fluid out. And so once we have that done, we can move on. So it's pretty much clean and ready to go. There you go. So we bypassed the draining of this ear, so we're gonna go over giving Dustin instruction on actually what to do in the morning and at night. So when you're using these discs, it's compression 24/7, if at all possible. We're wearing it at night, but you want to take these off in the morning, clean them. You want to clean the ear. You want to take them off in the evening. You want to check the color of the ear. You want to make sure that nothing's wrong. So we're going to load some antibiotic onto the front and the back of the ear. So we're going to quickly throw this on. And this is something that everyone who uses a Sytstem is going to have to use a couple times a day minimum, because you want to be able to slide these discs. So once this stuff's loaded, you're taking it, you're putting it on there, and you want to be pretty liberal with it. You can use Aquaphor once the risk of infection is down, but for now we're using antibiotic. And I'm going to clean that off, and we're going to take 2 of the medium discs. So when we're looking at these guys are cleaned, and we're going to throw 1 in the front, 1 in the back. What happens is this happens every morning. These get cleaned, the ear gets cleaned, and then we load these on. And what happens, what's really important, is that when he's using these, during the day, about every hour, every 2 hours, you want to sort of slide these over, move them down a little bit on the ear, let them rest there. Because with a hematoma, it's a large area. Sometimes they're small. Even if it's small, you want to take the pressure and distribute it over different areas over a period of time, so it doesn't stay stagnant in one spot. So I can slide them here and they're going to stay. I can slide them back up here and they're going to stay. That's really it, just from one position to another, maybe every 1 to 2 hours. So let's say he's gone through the morning, gone through the day. It's getting a little irritated because cauliflower is a little bit irritating, but it's not too bad. It's just moving these should feel relieving. So once this happens, evening comes, he's ready to check this out. He's going to take these guys off. He's going to clean these, but he's going to look at the ear, he's going to look at the tissue, look for any bruising, look for any redness, something's out of the ordinary. You know, you have an injection site. Usually what we did is really, really small. The larger ones you do need to watch, but you look for infection, you look for swelling, you look for any fluid buildup, because what these discs do is they compress the skin and there's a little a membrane in between those two that actually has a blood flow. Those have to be adhered. So if you get a little accumulation of fluid without knowing it, the whole process is sort of botched. Okay, so what's happening is, let's say it's AM or it's PM, he's getting ready to go to bed. You want to take these guys off and you want to inspect, you actually want to inspect the discs, make sure they're actually functional, there's no cuts in them, there's no, you know, areas where they're falling apart, which shouldn't happen unless you're probably, you know, beating them up or something. You want to look at the ear as well. You want to look for redness, you want to look for any kind of bruising. Potentially if these sit too long, let's say you had these on for 4 or 5 days, maybe the hematoma is already healed up and these are still sitting there putting compression. It can bruise if you don't move them around. So that's one thing. The biggest piece is to look at this area and feel for any softness. If there's softness there and you have the potential for any fluid within inside that ear, then you actually want to re-evaluate what you're doing and potentially get it drained again. So what we're doing is giving you an example of what he's going to be using at night. And this holds, you got a disc in the front and a disc on the back, and what happens is you just push those guys flat to the head and throw the headband on. You can bring it down a little bit farther, but that will hold these in place as you're sleeping. And so this is an absolute. If you end up having this come off or it's not comfortable, a timing of even 2 hours, your ears are going to fill up again. It wants to fill up no matter what. So this is a really important piece of the process. So to make sure you're clear, when you go to evaluate whether or not this thing is healed up, you want to test that out in the morning, not in the evening before you go to bed, because you could potentially, if it's not healed up, you take them off, hey, this thing feels great. It could fill up that night, you wouldn't know it, and then you're starting over. So in the morning, you want to take them off. Things feel good. You can put pressure on there. It doesn't hurt. There's no redness. There's no pain. And take them off, give it a couple hours, check it again. And if you start to feel a little puffiness or something, you put them on for a little while longer. But that's your gauge right there. It should feel pain-free, should look good, and should feel good. And then you're pretty much good to go. So that's helping him out at the final stages of getting these discs off. One last thing, do not train until after your ear is completely healed. For more information, visit us on the web at CauliCure.com.